I saw this thing fall out of a tree next to me, and it literally landed not that far away from me. And at first, I didn't want to touch her because I thought she might bite me. Before I knew there were cats and foxes in the garden, so I knew if I just left her there, she'd be food. And I just didn't like the thought of that, so I just picked her up and then I plonked her on my shoulder. And ever since then, we've just sort of been together. As soon as I saw her, I just thought Pablo, without even knowing if she was a male or female. But from day one, I felt very affectionate towards her, and she seems to show a lot of affection back to me. Who's that? The last year, I've been dealing with a lot of anxiety, not being able to go out and meet new people, and just kind of struggling with an awful lot of things.
So how's Pablo doing today?
Since I met Pablo, it's given me that extra confidence to meet people and go out and socialise again.
Does she have a favourite shoulder?
She does, and it's this one. I can't really think of life without her now, even though it's only been 3 weeks, which sounds crazy. Well, I knew from day one that there was something up with her because she wasn't flying around and she wasn't behaving like the other birds. And yeah, I just wanted to see if she gets better. I think the whole situation, a bird falling out of the sky that happened to land next to me, is very surreal. And I feel very lucky that it happened to me, to be honest. She's made such an impact. To lose her would be devastating, really.
This is Pablo, and I've come to see Jo. She's got a sore leg.
Hello.
Hi.
Hi, how you doing?
Not bad.
How's Pablo? Sleeping?
Some people will see parakeets as a pest. She's not an indigenous native species to the UK, but in her case, she is a pet to Luan, and they obviously have a very close relationship.
Can I have a little look at her?
Sure.
And just have a look and see how the leg's doing. She fell from a tree, right?
Yeah, she fell from a tree next to me. She still uses her leg, but she doesn't really...
She doesn't grip
grab
very
it,
well,
no.
does she? So I'm just checking whether she's actually able to use the foot to perch, because perching is so important for them. She's obviously using the left leg a bit more.
Yeah.
You found that when she's on your shoulder, she prefers to sit kind of one-legged.
Since I found her, she's been like this.
We just need to figure out why she's preferring to weight bear more with her left leg. And if she's not able to perch with the right foot properly, then she'll put all of her weight on the left foot, and that can lead to issues with the good leg.
Yeah.
So we just need to figure out why she's preferring to weight bear more with her left leg, even though she's able to grip quite well with the right one.
Yeah.
So I'm just gonna gently pop her in the towel so she doesn't get too stressed. And I'm just gonna quickly have a look at her 2 joints there. All right, Pablo. So what we'll do is we'll take an X-ray of her legs, and we can see how that joint's looking. She might have a fracture there, and infections can get into the joint.
Okay.
And so we want to make sure that she doesn't have that. To get good views, we need her to stay still, so we'll just give her a little bit of anaesthetic gas.
Okay. I'm remaining hopeful and optimistic, but yeah, I'm worried.
Okay, so if you want to wait for a little bit, and then I'll update you shortly when I've got some X-rays.
Okay.
Okay. Go. Hi, Nathan.
Hiya, what you got there?
This is Pablo.
Wow. So I'm guessing she's friendly.
Yeah, she's very friendly.
I think you turn into like the exotics vet now. We don't often get birds here.
Okay, Pablo, come on, darling.
So what are we doing then?
So we're going to take some X-rays of her legs. I'm worried there might be a fracture there. We'll have a look at the X-rays and have a look, but it's definitely that hook joint that's a bit swollen and why she's holding up the leg.
Well, let's hope you can find something on the X-rays and help her.
Okay, we're looking a little bit sleepy. Lights. X-rays. Nath,
Yeah?
I think it's a really bad fracture. You can just see the fracture there.
Wow. It's really painful.
And this was obviously the swollen joint because everything else is up inside, but when she's asleep, that's why we can't extend the leg properly.
So this isn't good news for Pablo, and it's definitely not what I was hoping to find. And I did think Pablo probably had a fracture, but not this high up, so it's a lot more serious than I thought.
Here we go.
Pablo. Hello. How is she?
She recovered from the anaesthetic really well, really quickly. But I'm afraid the x-rays didn't give us the news that we wanted.
Right.
The fracture's quite high up. Surgery is an option, but we have to consider that she's a really high risk for any anaesthetic. And obviously that one would be longer than the anaesthetic we did to do the x-rays.
Okay.
But she's healthy, she's good weight, she's eating, and so, you know, her chances are reasonable, but bird anaesthetic is really risky.
I thought it was going to be very straightforward. I thought she might need some medicine or an operation or even some physio. And no, it's very disappointing.
The surgery is very high risk, so we have to consider the other option, which would be putting her to sleep, because with a fracture like that, she's going to be in a lot of pain.
I'll have to give it some thought, but I probably will go ahead with the surgery.
They're not great options. At least with surgery we can try and fix it and potentially have a good outcome with a usable leg that's not painful, even though it's a higher risk because she's a bird.
I want to give her the best fighting chance. I feel like she's sort of turned up at the right time. She's helped me an awful lot. Now it's my time to help her. Here we are, Pabs. I've decided to go ahead with the operation. It wasn't too difficult to come to because the other options were so miserable. I mean, putting someone down that you love, it was a clear choice to go ahead with the operation.
Hi, Luan.
Hiya.
This is Scott.
Hi, Luan. How are you? Nice to meet you. Hello, Pablo. Aren't you gorgeous? All right, well, it's a big day, so let's go in and have a chat, shall we? Come on in. When Joe first showed me the x-rays, it was very clear that this was a fracture that needed to be fixed. There's two sharp ends of the femur, which is the thigh bone in the upper part of the leg, and they were broken in half and folded over. It's a pretty nasty break in this right leg, isn't it?
Yeah.
How are you feeling about that?
I'm upset to hear that, she's got such a serious fracture, but, I want to do the best for her, so go ahead with the operation.
Okay. The main concerns for us is the anaesthetic. But the problem we have with her is that she is going to need to be under anaesthetic for quite a while, for maybe anything up to an hour.
Yeah.
And that is always risky in birds. So we are quite concerned about that. And then of course, she's a young bird. And as a result, her bones aren't fully calcified and as hard as they should be. Mm-hmm. And so that will mean that there's chances that whilst placing a pin, they may fracture. So yeah, there's a couple of concerns we've got. Well, I'd say more than a couple. Mm-hmm. Hey.
She must be up higher.
You do. Hey? I see Daddy's quite nervous.
Yeah, I'm definitely nervous.
Yeah, I know. We're nervous too, because it's not something that you have to do every day. It's something that we have done a lot of research and a lot of study in preparation for today, but something that we're really, really hoping goes well and will give you the result you want, which is a bird at the other end.
Just fingers crossed. Literally in the last 3 weeks, we've bonded so much and so quickly, and the fact that there's such a risk that I might lose her, yeah, it's been difficult. Good luck, Pablo. I'm expecting the worst, but I'm hoping for the best.
We will give you a call as soon as she has woken up.
All right.
In the meantime, just cross hands, toes, fingers, whatever you can find.
Yep.
All
Thank
right,
you very
mate.
much.
Take care. We'll see you in a bit.
See ya.
Bye. Here's little Pablo.
Hello, who's this?
So this is Pablo.
Isn't she gorgeous?
Pablo. She.
Yes.
Chi.
Apparently, yeah, Pablo called Chi, yes.
Pablo is
Yes, that's the
Chi.
least of her worries today, Ems.
Yeah, I hear she's not doing so good on one of those pins.
Yeah, so the right leg has got a fracture, and that's what we're all here for today. So I think the big thing we all have to remember is it's all about efficiency. We need to make sure that we do things as well as we can, but as quick as we can.
Yeah.
So we just need to be the most well-oiled team that we've ever been to get the job done and
Yeah.
hopefully get Pablo through and back to Luan.
Okay.
We know there's risks, and I know that we all are nervous. I mean, I'm feeling nervous. I know that you guys are as well.
Yeah.
But all we can do is just do our very best. So we're breathing there, fine. So you can see those small light breaths there, okay? So now every 15 seconds, you're breathing. Right?
Yeah.
Birds are very delicate little creatures. They're very prone to stress, and under anaesthetic, they can just simply die. So it is a very nerve-wracking thing to knock a bird out under anaesthetic, and we need to make sure that we're all on our A game today. There we go, so knee there. Just feeling the fracture site properly for the first time. She's just so stiff. This fracture feels a lot different to what it looks like on X-ray. The muscles are so tight here that they've actually pulled this fracture underneath its knee. So it's like having a tip joint in its knee in the same position, which is clearly not correct. So what we've got here is very, very abnormal indeed. And because it's been like that for 3 weeks, all the muscles have contracted and it's led to a right mess. But unfortunately, I can't see how I'm going to fix this surgically, because to do so, I basically have to refracture the leg.
Is amputation an option?
I don't think we need to. The reason I don't think we need to is because she can feel her leg. She can feel her leg, she can place her foot, she can hold the toes around my finger. So I'm feeling now that actually we should pull out and we should allow her to wake up, because although this isn't a perfect life for her, I'd rather her be alive. And I think that she is relatively comfortable. I think that the fracture has healed, however badly. And I think that, Luan loves this bird, and I don't want to be the one that breaks his heart. Hello, sweetheart. Although we'd love to have pinned the leg, there actually was no need to. And even though it might make you look like you've got a bit of egg on your face because you thought you were going to go one way, but actually you went another, well, you've just got to brush the ego off and get on with it and get the best result for the animal. And for the animal, and I think for Luan, the best thing was to leave well alone. This bird is perfectly healthy. It has a weird short leg, but she's going to be absolutely fine. Welcome back.
I think she's hungry.
She's like, get off my leg. I wanted to have a perfect leg, but hey. It seems from the examination that we've done today that Pablo isn't in any pain. There isn't any chance that those sharp edges of the fracture site could cause any further damage. The healing's been done. It's not perfect by any means, but it's perfect enough.
Hey!
Here we go.
Oh, how'd it go?
Well, it was eventful. Your bird has something we're going to newly describe as a fifle, which is basically a very odd leg, knee, thigh joint.
So it's just a fused callus, so it'll always be deformed and she'll always have that kind of claw-like perch. But she can still perch and she's not in pain.
And is that not risk of infection or anything like that?
No, because the fracture is on the inside. The slightly sharp bit of the fracture that we can feel is on the inside of her knee. So it's protected from anything on the outside.
And it's great that we've been able to give back to you in one piece, and that's exactly what we wanted to do. And we know that we've gone through the process to try and give her the best treatment we can, and actually it turns out by doing nothing is the best treatment we can give her.
I really wasn't expecting a happy outcome, if I'm honest. I mean, I know I said I was remaining hopeful and so on, but just the chance of her not making it, I'm pretty happy. She's in good health and her foot's healing itself naturally, and that she can come to work with me tomorrow again, back to normal.
Ready? Ready? Yeah! Hugo and I, when we go to the park, we play a kind of game where it's like who's going to move first. You kind of like duck around. Come on! Woo! one of us moves and runs, and we just run around and jumping. You okay? I've always loved big dogs. So I was going into the vets to buy some special cat food for our cat, and there was this beautiful dog in there, turned out to be Hugo. And basically the guy who had Hugo just said, "Do you want him?" And I was like, "What?" Thought it was a big joke. Basically, it just wasn't going so well with this person. Him and the dog just didn't really gel, and he wasn't happy and the dog wasn't happy. Lovely boy. And there was Hugo, just so cuddly and friendly, and yeah, he was so handsome, I just decided to go for it. Look at that happy face. Yeah, happy dog. When we met him, he had this lovable nature around him, but there was just this insecurity. You could see that he didn't quite feel safe in the world, and I really related to that. And I said that to him, and I said, you know, I'm going to take you by the paw and we're going to do this together. You know, you and me, we're going to feel safe in this world together. Can you do some up dog with me? No, just sleep dog. I work for myself, and I was finding that I could get a bit lonely during the day. Oh, very good, Hugo. And just being here with Hugo now just makes all the difference. We're not really nervous about his first vet visit. I think it's just to be sure and to be on the safe side. We just want to have him checked over. Every day I just look at him and just fall in love with him a little bit more. He's just the most gorgeous being, and I adore him.
I love you. Yes, I do.
You alright, mate?
Oh, I'm a bit nervous, to be honest, but there's nothing wrong with me.
I'm sure you're going to be fine.
Hello, you must be Hugo.
Yeah, this is Hugo.
Look at you. Hey, you've got to have a voice like that. Has he got a voice like that?
Hello, my name's Hugo. I'm very handsome.
Yeah. It's absolutely beautiful, aren't you, mate?
I have a secret passion for big, buffy dogs, and he very much fits the bill. He's a perfect dog.
Should we go and see you in the consult room?
If I have to.
Come on then, let's go.
Natalie's just got Hugo, so we don't really have much history, so it's really important that we do a full physical exam just to make sure that he's healthy as he starts his new life.
I can tell you guys are a little bit in love already, aren't you?
Completely. It was love at first sight.
Can I have an examination of you, hey?
I suppose it's for my own good, isn't it?
Very rarely when I'm treating animals do I hear them speak, but for Hugo, he's got an incredible deep, booming voice in the form of Natalie.
The old ticker okay?
Sounds good, yeah.
Let's have a look at those big choppers, hey? Okay.
Ooh.
Okay. Is that the first time you've seen that, Natalie?
Yeah.
Whenever you see a lump in the mouth of an animal, that's always a concern. The reason being is they're very black or white. They're either completely benign and nothing to worry about, or fiendishly malignant. And the animals that have that type of tumour can be dead within months.
If it was anything untoward, would he be having any symptoms?
When it progresses, there's things like bleeding from the mouth. You might have some pain when he's chewing things. You might see some loose teeth. All those things might be something. Are you seeing any of that at all?
No, there's sometimes a little bit of blood if he chews like a really big, like one of those big rawhide bones.
Okay. So that's very much something that we need to look at straight away. It's not something we want to leave.
Yeah.
And particularly the love affair that you guys have already struck.
No.
We don't want to break your relationship up, and I think sometimes we have to jump on these things quickly and just make sure it doesn't get out of control.
As a vet, we see relationships between owners and animals all the time. But the relationship that Natalie has with this dog so soon is incredible.
I'll probably be fine, Hugo. Eh?
She absolutely adores him.
Baby boy, you're gonna go for a little sleep.
And then after that, we'll find out what's wrong.
He's only just come into our lives, so I just can't imagine or think about it not being okay.
Natalie, you're staying with me,
See
buddy.
you later, baby. My bite. Oh, God.
Come on then, Hugo. Good boy. Hey, Ems.
Oh, my goodness. Hello. I know you said you were bringing me a big dog, but this is...
A horse.
This is a horse.
He's a horse. He's a big, handsome horse. Yes, he is.
Hi, buddy. Then what's your story? Hey?
Well, this is Hugo. He's a rescue boy,
Okay.
and unfortunately, I've just found a lump above his canine. It just looks a little bit nasty. And as you know, with oral tumours, they're always something to be a little bit wary of.
Yeah, absolutely.
So what we need to do is knock out this boy, and then we just need to take it out and send it off to the lab.
Okay.
So what are you doing? Didn't come here for a haircut, mate. No.
Oh, I know.
Oh,
we
so
should
big and scary. Come on. I know. I know. It's a horrid noise, isn't it?
So you get used to it.
Good
You're
boy.
a big baby, aren't you?
Oh, my goodness. Is he snapping? Is he getting snappy?
To knock out Hugo, we need to place an IV catheter, which allows me to give him the anaesthetic he needs. But unfortunately, big Hugo is a bit of a baby, and he doesn't like the clippers.
And it's all done, see?
That is all done,
It's all
buddy.
done. There, you're friends again. Thank you. We're friends. All right, so sleepy time now. I'll get that nasty lump out of your mouth, shall we?
When we deal with these massive patients, it is a bit of a mission to get them anaesthetised appropriately and correctly while trying to manage their size. So it's definitely putting us to the test.
Okay, one, two, three.
Now that Hugo's under anaesthetic, I can really see this lump, and it's a very angry looking thing, and it's extending quite a long way down the enamel of his canine. So what I'm going to do is basically cut it off at where the gum line should be, and hopefully in future that'll mean that he won't bleed as much when he's chewing things. Right, well, Em's alongside, and it's just I need you to be chief lip holder.
It's not a title I get assigned every day of the week.
No. This isn't the most elegant of surgeries. I'm literally just going to have to lop it off and try and get it back to where the normal tooth gum interface will be, which is sort of right back here. That will just lift away. Okay. One nasty lump removed. All right, so that's that. He's got a lovely new gum line. And we've got the horrible lump off, so I think it's time to wake him up. Good boy, there we go.
Good boy.
There we go. Oh dear.
Hello.
If it is something sinister, it's really concerning. So we'll just have to wait and see, cross our fingers and hope for the best. Boy.
If you hear that there's something wrong with your animal, even if it's a small thing, there's always a slight cause for concern, because you just hope that it's not going to become a bigger problem, and hopefully it's nothing to worry about. So I'll try not to think about it.
Oh, I can hear.
Hello.
Here you go, who's this?
How's my boy? Hello. Hello. It's me. I cannot believe you're not more excited.
Oh, you a bit dozy. How's your mouth, Poppy?
Yeah, I'm really happy with the result.
Yeah.
It came away really nicely, and now he's got a nice, clean gum line. You'll be able to see. So that's normal, and then this is the new one. So you can see it's nice and straight and clean now.
Oh, yeah.
Yeah.
Wow, what a difference.
So I think that just by removing the tumour, it's going to improve his quality of life, because the bleeding that you've seen, I think, is because that growth, whatever it turns out to be, has been growing down the tooth, and as a result, has led to just getting in the way of normal chewing and biting and things. So I think we're going to have made a big difference to that. And now we've just got that anxious wait for the next few days.
The results.
Yeah. You a bit anxious too about it, hey?
Yeah. Very happy that the lump's come away, that it's come away clean. Obviously apprehensive about the results, because we still have to wait a few days for those. And, you know, just hoping for the best, really. You know, coming in for a health check and then spotting something, and to have it treated very quickly is brilliant. And then Hugo will hopefully be okay, and life can resume as is, the new normal with Hugo, which I can't imagine a normal now without Hugo, because it's just such a fabric of my life already. Come on, Hugo.
Come on, champ. Wake
Come
up.
on, big fella.
Time to go.
Let's go home.
Good boy.
Off
Here we go. Good boy.
Thanks, Scott.
All
See
the
you
best,
soon.
Natalie. Bye, Hugo.
Bye.
Bye, handsome man.
Thanks, Scott. Bye.
Bye, mate.
See ya.
Bye.
Hugo, what's this? Are you interested or do you just want to sleep some more?
Is it steak?
No, it's dog food.
Oh, I want steak. Well, what are you having for dinner? Can I have some of that?
Hugo's favourite snack, I think, has to be cheese. It's closely followed by eggs, tomatoes and grapes. Here we go, dinner. Yummy. Scott gave us a call the other day to tell us the good news that he has the all clear, which is, yeah, brilliant news. Mwah. I was saying I wasn't worried, but underneath I was just desperate to get those results, and I don't think I'd realised how worried I was until we heard that he was okay, because I got really teary and was just so relieved. Who's this? Who's this? Oh! Hi, Hugo! What a greeting! Hello! Come on, Bella! Come! What are we doing? Hiya! It's always a little bit special when someone opens the door and I'm greeted by the big, handsome, gorgeous, wrinkly face that is Hugo with his big slobber chops. What's this, Hugo?
Oh, cheese. I love cheese. Give me paw. Oh, good boy.
So nicely as well. Oh, you love the cheese. I love Natalie's Hugo voice. That is completely how he would sound. Would he be human? Oh, big boy. It might sound mad, but it kind of keeps me sane. And I hear the best part of all of this is that he's had the all clear from Scott.
Yes, he has. Such good news. And then I was a bit emotional when I heard, because I was just so relieved. So relieved. I just got a bit teary. We were out for walkies, weren't we, when we heard the news?
Hugo, can I have a look at it then? Can we have a peek
Can I
to
show
see?
Auntie Emma? Hey? So since the surgery, Hugo's mouth is looking brilliant. There's barely a sign that any surgery has been performed. His gums are looking healthy, his teeth are looking great. So yes, very pleased with his progress.
Sometimes I think you're a dream. I do.
Breaking hearts all over the place, you, aren't you?
Go on, give it a kiss. Ooh. Hugo loves the ladies.
An 8-day-old chihuahua puppy.
Puppy.
Brought in by a very worried owner, Charlotte.
He was born with a cleft lip and cleft palate.
Oh my God.
Let's just have a look and see. Oh, wow, okay.
The deformed palate means every day of the little chihuahua's life has been a struggle.
Oh, sweetheart, you're already looking hungry, like you're trying to eat your hot water bottle.
Because he can't latch on to either his mum or a bottle, and he isn't putting on weight.
At birth, the vet stitched up all the roof of his mouth and stitched up the hair lip, and the hair lip's just not holding. He's had to be restitched 3 times already. Something more permanent has to be done.
With the temporary suture out, is he able to suckle at all?
No, he can't. He hasn't got the vacuum that's needed to get the milk out.
Yeah, I mean, look, he's already hungry, you can see. Aren't you, mate?
There's now only one option left, more surgery, but this time under anaesthetic. A risky thing for such a young dog.
Let's go into the consult room and we'll chat about this very fraught surgery we're going to have to do on you, little man. Come on in. I have absolutely no choice. I need to perform surgery today. Yes, he's 8 days old. Yes, he's a high-risk anaesthetic, but I have no choice because without performing this procedure, he can't latch onto mum, he can't suckle milk, and unfortunately, he will end up starving. Well, this type of patient and also this type of surgery is incredibly fraught and not something that we want to do. But in his case, if he doesn't have the surgery, he will basically fade away and starve to death. Yeah, the other possibility is that he can also aspirate the milk, breathe it in and die suddenly. And you've only had him for 8 days, but I can tell you're quite smitten, aren't you?
Yeah, he's stolen my heart. Absolutely in love with him. He's like a member of the family already, and I've been hand-rearing him for the last 8 days. I'm so in love with him already.
Well, I'm gonna take him downstairs and see the team. Say goodbye to your little man.
Good boy. General anaesthetic for an 8-day-old puppy's never good. It's never something you want to do, but it really is his last hope. I'm just scared that he's not going to make it.
Hi, guys. Hiya. Right, so we've got a difficult job in our hands today, guys. So we're really going to have to keep our wits about us because you can just see the size of that hair lip
Oh my God.
Yeah.
It's really sad.
But now, unfortunately, the temporary sutures that were put in at birth, you can see, have just blown, and now he just can't clamp down. He can't just get the suction that he needs to suckle properly, because you can see there's actually a little tiny little hole just there, like a pinhead, but still it'll be too big and he won't make it. So we do need to perform an anaesthetic and surgery on this guy.
Nurses Nathan and Reagan will assist with the challenging task of anaesthetising such a tiny patient.
It's an anaesthetist's nightmare, that is.
Yeah, well, I think it's anyone's nightmare.
Yeah, you know, a young animal, old animal, we all know that they are the riskiest.
And he won't make it if we don't do this. All right, let's start the process. Just a little bit of anaesthetic. Everyone cross your fingers and toes and paws. Because we have to do surgery on his head, we can't have his head in a mask.
No.
So when we get down to a point where we think that he's deep enough, we're going to quickly flip him round, okay? And then Reagan, if you can extend his head, and then I'm going to hold down his tongue and try and get the tube in, all right? First task to be tackled is to try and navigate the anaesthetic. Can we place a tube down his throat? Can we place a tube in his nostril? Let's give it a go. So you're going to pull the mask off and you're going to spin him round to me, okay?
Ready?
3, 2, 1, go.
Scott is hoping a narrow tube down the throat will be the most effective way to administer anaesthetic to his tiny patient.
Puppy.
But it's proving more difficult than he thought.
The tiny little head has a really big tongue and gets in the way of our ability to look and see the larynx and pass that tube through. Yeah, just going to gas him down a bit more, it's too light. What is he on now? Is he on 5?
4, it's a 4.
So put him up to 5. I think what we'll do this time around is we'll just try straight onto this. So we'll go into his nose, try this. Because he's so small, he's got such a fast metabolism, so he's quickly removing the anaesthetic from his system. So he's giving us such a tiny little window to perform this microsurgery. It is really proving tough. Okay, let's try again. Attempt number 52. Not sure, but maybe. I know it's so difficult to tell, but can you see the bag moving, Reagan?
No. Oh, wait, actually. It's like it's sort of working, but not completely.
Yeah, so I'm going to take that out and we're just going to try the mask. All right, sweetie. Okay, so the new plan is basically can't get the tube down and he doesn't seem to be tolerating the nasal tube either, so we're going to keep him nice and deep. You're going to just put it over his nostril. I'm going to scrape. We're going to put it back on.
Okay.
All right? The pressure really is on Nathan and Reagan. They're the ones that are responsible for the anaesthetic, maintaining that and ensuring that he recovers from it. So it is quite a high pressure procedure. He's a tiny puppy. So I'm just going to scrape the edges, okay? And then we'll put him back in the mask. When we're all happy again, and Nathan, you think he's deep enough, then I'll be putting the sutures in.
Okay.
All right? All right, let's go for it, everyone. Ready? 3, 2, 1, go.
With the anaesthetic now finally working, Scott can clean up the pup's lip and at the base of his nose. He can then place sutures to permanently hold the edges together.
Okay. Ready? Yep. So just take our time, control our nerves, and we'll go back in. His heart's beating nice and strongly throughout, so and as much as it's not very nice to hear him cry, it's better that than him not survive. So a little bit of pain for long-term gain. Sorry, baby boy. You have to do it one suture at a time. Puppy. Never had to do surgery in bites of 5 seconds before.
No, this is crazy, but...
It's got to be done.
Yeah.
Yeah, difficult. Just need to keep telling ourselves we're doing it for the right reasons. He won't survive unless we do this, so I'm sure he'll thank us eventually. Just if we want to do the right job, I know that it's tough, but I think we need to just put one more suture just on the inside. So if we gas him down one last time, then that should be it, okay? So after the speed surgery and those little windows that I was able to place the sutures, I'm actually really happy with the cosmetic result, and we're done. The lips have come together. I feel that now he will be able to produce suction in order to feed from mum, and hopefully he'll go on to grow up to be a nice little chihuahua puppy.
Bless him.
He makes the cutest noises, doesn't he? Oh, man, he wouldn't go to sleep, and I feel like I need to now. That was tense. We've put 3 sutures in exactly where they need to be. He now has a nostril. He now has a fully formed hard palate. The fact that he fought us so much on the anaesthetic that he was screaming blue murder at points just shows his character, and that will really bode well for the future of this little guy. Yeah, gotta love him. We did it. Here he is.
Upstairs, it's been an agonising wait for owner Charlotte.
So, literally just out of surgery, and it was very, very challenging. But he is as tough as nails.
Now you can see why I wanted to do it.
Yeah,
He's got such fight.
he really does. So we'll be taking the suture out in, well, maybe 10 days, 2 weeks. We'll see how it goes. We've put a non-absorbable one in there, so it will stay for as long as we feel it's necessary until he's just a bit stronger and a bit bigger. But right now, he's done great.
I think you need to name him.
Why don't we call him Cliff?
Cliff.
Yeah.
Yeah. Now to get him home, get him on mum, get him feeding, get him back to bright and alert like he normally is.
You guys better get off. He needs to go and have a drink, and I think you need one too.
Yeah. Agreed. Thank you.
All right then, Charlotte. Take care, sweetheart.
And you, bye.
Bye, little man.
In Isleworth, cat rescuer Liz is turning up with 3 of her latest cases.
I brought 3 cats in to see Scott today, very carefully selected from our little residential family. The first cat I brought is Mr. Tiddles. We've also got Mr. Woods, who's like an abominable snowman. And then there's Narnia, who's a sweet little petite black and white cat. And they're all ones that, although they're ticking along quite well, I want to make sure that their issues are addressed quickly, like if they need dentals, which are so important. I know Scott's told me how important it is to keep their mouths healthy.
Liz runs a sanctuary that cares for hundreds of stray and rescued felines.
We started off as rescue rehoming, but then we found there were cats that weren't easy to home, maybe because they're either feral or elderly or have health conditions that need lots of support. And we're very vetty-minded, so we try to keep up a good level of veterinary care for each individual cat.
I'm always amazed at your sanctuary how that many cats get on together.
They really make friends. It's incredible, yeah.
Yeah. Oh, it's
they hang
beautiful.
about together and form their little groups. And...
Yeah. All right. Well, can we help Liz get these 3 into the consult room, please? In we go. Whenever Liz comes in with her cats, I really want to do everything I possibly can on the one day. She's got 200 cats to look after, and I've got 1 chance to get them right. So, Mr. Woods, I can feel he's got lumps of hair here and there and everywhere, haven't you, my boy? So definitely we need to try and sort you out. Wow, can I just point out how beautiful his eyes are? He's got 1 blue and 1 green eye, which is amazing. The only thing I would say about that is that there is quite a lot of scientific evidence about the presence of blue eyes and the pigmentation in a white cat leading to deafness.
Yes.
Quite an interesting quirk that we encounter with white cats with blue eyes is that some of them can suffer with hereditary deafness. So we don't know why there is a link between the colour of your eye and not being able to hear, but it is present in up to 80% of white cats. So we can hear that for sure. So can you call them again, please, Liz? I'm just going to jump.
Mr. Woods.
I think he probably is deaf in that left ear. The left side is where his blue eye is, so I think he is deaf on the left. Okay? You got 1 ear that works and lots of buddies. So there you go. Never mind. Stinky, mate. I'm so sorry. Lucky you can't hear, because in this ear I'll just say you smell really bad. Sorry, but you do. A little bit of a spruce up. That's what you need, isn't it, mate? Hey? Mr. Tiddles was next, wasn't it?
Yes.
He's very handsome.
Oh. Mr. Tiddles, alongside being very affectionate, also is a little bit smelly, and I'm picking up that he's got some quite bad breath, so I think he'll definitely need to have some dental treatment, but also he has a little bit of dark pigment discharge in his ear that we'll need to clear out.
There we are.
Hello, beautiful. Hello. You are lovely, aren't you?
Next up is 4-year-old Narnia.
Oh, you're not making it easy, are you?
So that looks like it's a little bit of snot coming out there. So she definitely has a little bit of a respiratory infection by the looks of it, Liz.
Yes, I've been keeping her separate actually at home.
Good. All right, Liz. Well,
okay.
If you say goodbye, little Narnia, and I'll look after her and the other two, and I'll
Thank you
give you a
very
call
much.
once they've all woken up.
That's lovely. Thank you very much. Be a good girl. I shall be looking forward to seeing them later, hugely. And they're such characters as well, so it will be lovely to know that they've had everything done and we're on the right road to having happy, healthy cats.
All right.
Thank you.
See ya.
Thanks, Jessica. Bye-bye.
What are you doing? You're crazy, aren't you?
Now you've only got the two of us. Is that going to be enough? So no, we're like 3 people on hand at all times. No, definitely not the first, and it absolutely won't be the last. The woman looks after so many cats.
At his Isleworth practice, Scott and Jess have started the Moggy makeover on 3 rescue cats.
3 of them makes for, well, a fairly busy afternoon, but hopefully by the end of their procedures, they'll be happy and healthy and going back home with the lovely Liz.
First up is Mr. Tiddles, who needs some major dental work.
He's got some really pungent breath, which is why I'm wearing an outfit that looks like I should be handling toxic waste. I am a little bit, his breath is pretty bad, but what he does have is some pretty rotten teeth, which is the cause of his problems and his bad breath. And they're quite difficult to remove, but also it is only maybe a centimetre from the eye. So one false slip and you can literally stab it in the eye. Dental health is a really important part of looking after a cat or a dog because when you've got tartar build-up, you've got a huge amount of bacteria lurking in your mouth, and then you're swallowing that every single day, which is having a really harmful effect on his liver and his kidneys and his general health. So to remove these rotten teeth removes the source of bacteria, and literally overnight the cat can feel $1 million. You go. So you got 2 healthy roots there, and then you got this rotten stuff back here. Okay, so we can wake this boy up.
Hold on.
Yep. So he can go back, please, Jess. It's fine.
On to the next one.
Next, Narnia has a badly congested nose that Scott is going to flush.
So we're just going to wrap her up in a towel, put the cat muzzle on, and then give her a little injection in her butt. Okay. Oh, there we go. There we go, there we go. Good girl, good girl, well done.
So brave.
Narnia is quite the feisty girl when you're trying to do things to her she doesn't like, and that's the reason why no vet or vet nurse will ever be a hand model.
Just a couple worries.
Ouch.
Thank you.
Yeah. Try and get a sample of this stuff.
Narnia is very likely to be suffering with cat flu. It's caused by 2 viruses, either calicivirus or herpesvirus, and can lead to a very snotty nose. Yeah, look at that. Gross. The best way to clear a cat's nose is by actually performing a flush, so putting a saline solution in one nostril, packing the throat, and have it fly out the other nostril.
Oh, man, that was gross.
It's quite a lot for a little cat, isn't it?
Yeah, loads.
But I think that she is going to feel so much more comfortable, and as my Nana always used to say, better out than in.
Come on in.
With little Narnia now more comfortable, the team can move on to their last patient, Mr. Woods.
Okay. So Mr. Woods has a few issues. He has some pretty disgusting ears. So we're going to give them a good clean. And whilst I'm sorting out his head end, the girls are going to be defluffing him. Oddly enough, I have an allergy to sort of certain long-haired fluffy cats. They just make my eyes itch and make me a bit sneezy.
When I first met Mr. Woods in the consult room, I can tell straight away that he has some really smelly ears.
It's actually horrible, isn't it?
They have a lot of discharge coming out of them, and they do need to be swabbed to assess for the type of bacteria that are growing within them. And after we've done that, we're going to give them a good clean and a good syringe out with saline.
So, how are you getting on?
Yeah,
Half shaven.
half shaved.
All right, let's flip him over.
For some reason, nurses absolutely love performing grooming on cats. I think they find it quite therapeutic, and it's a great way to see a before and after, knowing that a cat's coming quite mangy and going out looking quite sleek.
After nearly 4 hours, the marathon makeover on all 3 cats is almost complete.
He's done. Oh, all finished.
Right, so we've got healthy cat
and half a cat, and we're all wearing the cat. He's certainly left his mark on the practice, hasn't he? Liz was concerned that Mr. Woods might be a bit of a handful, and the only handful he is a handful of fluff, because he's actually the perfect gentleman.
Narnia and Mr. Woods will be started on antibiotics for their nose and ear infections.
All three of them should really have a greater quality of life after what we've done today. So now they're just sleeping off in preparation for being collected by the lovely Liz.
Good boy.
Come on.
At the St Margaret's Practice,
Not going to the park, I'm afraid.
David and his 18-month-old spaniel Saga are arriving for an appointment with Scott's colleague, Vet Phoebe.
Hiya. Just got Sega for a checkup.
Hello.
Hi, how you doing? Come here.
Look at you. You're so
She's got a little problem with her eyes.
Oh,
She needs to get checked out. Sega has been having discharge from both of her eyes, and one of them is worse than the other. So it's been going on a few months. So we thought we'd just bring her in and make sure there's nothing untoward.
Right, so it's this discharge that you've been talking about here.
Yeah, and sometimes it's all the way down to her lips. But I don't know if there's maybe a little bit of irritation in there.
Yeah.
I wondered if the cat maybe had nicked her and caused some trauma, or if it was something else. So I just wanted you to have a look.
Is the discharge always sort of clear or?
It's like, clear or ready colour.
Okay. So that means it's probably less likely infection, because normally if it's infection, it's greeny or yellow. So right away, I can see what the problem is. Okay. Right in the inner corner of her eye, where the discharge is coming from, I can see some small hairs, and it looks like they're probably rubbing on the surface of her eye.
Right.
Oh yeah, so it's the same on the other side. There aren't many, just a few little hairs, but you know how uncomfortable it is when you've got an eyelash in your eye, so.
And it's always there, it's going to be driving
It's always
mad.
there. It's not that uncommon to see hairs growing in abnormal positions on the eye in dogs. Normally when we see it, it's either along the bottom or the top border where the eyelashes are, not in the corner. If we were to pluck those hairs, then it would provide relief for her, but then they're just going to grow again. What I think would be better in Saga's case is cryotherapy, which is basically an ice pen, and you can use that to freeze the follicle, killing it and hopefully preventing recurrence of the hairs. We've done it before on eyelashes along the bottom rim with really good results, but I've never done it there before.
In the corner,
it will be a first for me. I think it would be a good idea to do it.
All right, let's do it.
As it's a potential cure for
Sorry, Sega.
Oh, she thought she was coming in for a checkup and now we're keeping her. Oh, I'm really sorry, little one.
Come on. Good girl, that's it. How are those legs working today?
Before heading into work, Scott is taking some time out with one of his favourite patients.
Good girl, like a spring lamb.
His own elderly dog, Betty.
Today I'm taking Betty for a little walk to our local woods. It's our favourite place. It's a beautiful, magical place. It's a nice, calm place where a lovely, genteel old lady can enjoy herself. Come on, Nana. There we go.
It's a big week for Betty, with a birthday soon and her annual checkup after a freak accident 2 years ago, followed by major back surgery. Scott had been playing with Betty in the park when she suddenly collapsed.
She's burst a disc in her back, and some of the content of the disc is now squashing the spinal cord. Worst case scenario is she never walks again.
I knew it was bad, but it's really bad.
Betty's only chance of recovery was a risky spinal surgery, with no guarantee she'd be able to walk again.
Clever girl, look at that.
Fortunately, the surgery went well.
That's it, come on.
And after 2 weeks of intensive physical therapy, the terrier was able to take her first steps.
This way, baby. Come with Daddy. Should have a little rest.
These days, Betty still has a few niggly reminders of the traumatic injury.
Come on. Share a little seat here. It is true to say that Betty now has a disability. She does struggle to walk. She's weak on her left leg. I know. Oh, thank you very much. Okay, you do massages first. There you go, sit there. You like massage, don't you? Ooh, there we go. She is sort of wonky, really. She's got a tail that doesn't really wag, it sort of goes round and round like a propeller. And she just struggles on long walks. So giving her a little massage and a little nana break in the middle is fair enough. So good. Loosen up all those muscles. We'll have to go and see your Uncle Michael soon, won't we? Hey, after he did his miracle surgery on you, fixed you up. Hey.
Betty's also about to have a birthday. So after the visit to Michael and hopefully an all clear, Scott is planning a special celebration.
I love my girl. Yeah, I do. Betty is just about to turn 12, which is incredible, really, considering everything she's been through. So in order to properly celebrate, we're going to throw her a 12th birthday party, which sounds absolutely bonkers, but we're going to do it anyway. And it'll be great. What do you think? I'll take that as a yes.
The party is planned for later this week.
Come on then. Let's go home. Come on. You need your nana nap, don't you? Come on, let's go. This way. Good girl.
Hopefully we'll be able to reunite them soon. It should be a really quick procedure, I'm hopeful.
Okay.
At the St Margaret's Practice, it's time for nervous 18-month-old spaniel Sega's surgery.
All right, should we go to sleep?
Graduate vet Phoebe is going to use a freezing process to remove irritating hairs growing in the corners of Sega's eyes.
Nice and sleepy.
With nurse Gina assisting, it will be the first time Phoebe has used the cryopen technique.
I'm feeling the pressure a little bit. Every new day, there's a new experience, there's a new thing to try, and so this is just another hurdle that I'm going to have to try and cross. So now Sega's asleep and we get to have a sort of better look at the eye, where the hairs are coming out. The tissue actually looks kind of different to the rest of the conjunctiva in that area. It looks darker. So what we could be actually dealing with here is a dermoid, which is an abnormal sort of growth of tissue, and that can have hair follicles in. The advantages of the cryopen is that it's really quick, it's less painful than surgery, the recovery time is much quicker, and if it's successful, then Sega will be able to just go home today with a little bit of pain relief, and that's what we're aiming to achieve here. So I'm just going to try and move these eyelids so I have as much space as possible, whilst also keeping that duct nicely out the way and keeping the cornea covered. We're going to have to be really careful that we don't irritate the surface of the eye itself, because that is obviously a really sensitive area, and there's a couple of other structures in the vicinity that we're going to have to be careful to avoid. But the cryotherapy pen has a very specific diameter of the area it freezes, so we should be able to just target the hairs and nothing else. So hopefully at this point I can just remove these hairs now with these forceps, and they should just come out really easily.
But there's a problem.
My forceps just aren't gripping them.
The abnormal tissue or dermoid that the hairs are growing in is too deep, and despite being frozen, they won't budge.
No, they're not gripping them. I don't know whether I should just call Scott and see if maybe he can come and remove them surgically, because they're so deep. I don't want to penetrate too hard and damage other structures. So I've been persisting with the cryopen, but I'm still not 100% convinced that we're getting the penetration that we need to with these hairs. So I'm going to need Scott's help for this one. We're going to need to go to surgery. Is she stable? Yeah, she's stable. Okay. So you can go and call Scott.
I'm here because my colleague Phoebe's found a dermoid cyst, which is actually quite an odd thing in a dog's eye. It's basically just a patch of skin in the eye, so clearly that's going to be quite irritating for the dog. But unfortunately, the cryopen, the freezing pen that we use, isn't really penetrating deep enough. And if it penetrates deep enough to kill the follicles, it might also damage the cornea behind the third eyelid. So that's why we are going to have to now move to surgery. Can you think what that would feel like, having hair constantly growing inside your eyeball?
I know. If I had one eyelash in my eye, you'd hear about it.
Yeah.
Let alone how many she's got.
A whole patch. Deep. See how deep I have to go to get underneath it. So that's the first one.
Oh, wow.
Let's come off. You can see the hairs on there. There's quite a few.
Yeah, there's like 10.
So I've just removed the first dermoid, and it was very deep, very close to the eye. So it was the right thing to call in the recruits for this particular surgery. Phoebe wouldn't have done this kind of thing before. It's very delicate stuff.
Scott is now going to take out the cyst in Sega's other eye.
It's always quite satisfying when you can see all the hairs on it.
So by removing the hairs completely and removing the roots as well, the hair will never regrow. Right, so let's wake her up.
We had a bit of a hiccup at the start, a bit of a dramatic change of plan, but that's just something you have to adapt to as a vet. Her anaesthetic was nice and stable. Scott was able to come in really quickly and save the day. The eyelashes are no more, so yeah, we're all happy.
Sega will sleep off the anaesthetic before going home later today.
Oh, haven't you been brave? I don't think she's going to be happy till she's home. Home and tucked up in bed.
Hello.
Hiya. Who have you got there?
I've got a little bunny. Look at him.
In Richmond,
He's very sweet, he's very chilled.
practice manager Maz has brought in a rabbit that needs a new home after his owner passed away.
So I was thinking, could Auntie Nathan maybe just make sure little bunny is all okay?
Yeah, I'm sure I could have a quick look.
Come here, little bunny. There we go, what a good bunny.
What I'm going to do is start off looking at the teeth, because with rabbits, because their teeth constantly grow.
Oh, okay.
And a lot of rabbits now, they got malocclusion, which means their teeth don't match up and they don't grind down, so they often grow really long. Yeah, so those teeth are quite misaligned.
Oh, yeah.
But certainly could do with a little trim. So that just in between those teeth there. So it stops me catching on the tongue. And I think, you know, this will really help with those two teeth meeting up again.
Good boy.
That's one side done.
All right.
Now it's just onto the other side.
Oh, so heart's going crazy.
Yeah. Yep, that's the other side done.
Oh, that's going to be better, though.
Have you got any ideas for a home yet?
I'll take him home tonight to make sure he's okay and he's eating all right. I'm sort of the only human that this bunny has right now, and I suddenly feel very parental with the whole situation, a bit of a sense of responsibility that this little guy's going to be looking at me for some kind of guidance, and I'm his mummy for now.
So what are you going to call it then?
If you name him, then you keep him. But he does need a name. He's my little buddy. You're my little buddy. Come on, then.
Back in Isleworth, cat sanctuary owner Liz has arrived to collect her 3 patients.
I'm not really missing them because I know they're in good hands, but I shall look forward to seeing them. Yes, very much. Goodness me, look at you, Mr. Woods. Wow, look at that lovely fur. That must feel nice, mustn't it?
Hey, if you weren't hit with the ladies before, you're definitely going to be with a new hairstyle.
Going to feel like a new
nice
man,
breath.
aren't you? That's lovely. Oh, you're a very lucky pussycat, aren't you?
So while you snuggle on him, Mr. Tiddles had 7 teeth removed.
Gosh.
So we've had to remove all those teeth, but he's going to feel so much better with them gone.
Oh, that's really good. He's such an affectionate cat. It'd be nice to see him all comfy and happy.
But this madam, wow. She went from a lovely, demure feline to a caged beast when you try to do anything to her.
Really?
One of my nurses has a nice battle scar all the way down her arm to prove it. So, but there you go.
Oh, goodness me, Narnia.
So she had some pretty mucky ears, so we've cleaned out her ears. But the bigger thing, which was actually quite rewarding and disgusting in equal measure, was flushing her nasal passages, and a huge, big lump of snot came flying out. So by flushing that out, it's going to make a massive difference to her quality of life immediately. And I actually feel already she's breathing a lot quieter and a lot better as a result.
I think all of our cats at the sanctuary, they're like a family. And our team of helpers there are so passionate about them and so proactive with them. And the work we do means everything. It's part of my life, seeing that we can help these cats and do something positive to give them a good life.
I'll take the heavy one. You take Princess, troublemaker. All right, and let's get you out to that car. For someone that looks after so many cats in her own house, gives up so much of her time. She's an absolute marvel. She is the queen of cats. So you're all very lucky pussycats, aren't you? Hey?
Up we come.
At the St Margaret's Practice, it's also time for Phoebe's patient, Sega, to go home with owner David.
Hello,
there
puppy.
we go.
Sega.
Hello. Hello.
Oh.
How you doing? You all right?
As soon as Sega came up the stairs, she went bounding into David's arms. Obviously, we have to do procedures on animals and we don't like to separate animals from their owners, but it's always lovely to see them reunite again at the end of the day. Everything went well. We tried to use the cryopen, and when we were freezing the hairs, we noticed that they were a lot deeper down than we thought. So Scott had a look at it as well, and we think it's a dermoid cyst, which is a little patch of abnormal tissue in an area where it shouldn't be. But in her case, that little bit of abnormal tissue is growing hairs that shouldn't have. So we've removed that in its entirety.
Okay.
And then hopefully she should make a full recovery and no more hairs.
I'm glad she's not going to have any of that irritation anymore.
Yeah,
She'll be
exactly.
able to just swim and run and do what she normally does without any of that irritation.
Exactly.
Yeah. All
She
right.
should feel a lot more comfortable.
She's obviously been through a bit of a trauma today. She's feeling quite sorry for herself, but I'm glad she's okay and it went well, and she can, get on the road to recovery. Say bye.
Bye.
Soppy dog.
Yeah.
Oh, someone's home. Hello!
Hi!
Oh, wow. A little handful of cute there.
A few days later, Scott is making an important house call to check on tiny cleft palate patient Cliff.
So that's proud mum Dolly, yeah?
It is, bless her.
Hello, you about to feed your babies?
Cliff's holding his own with his brother and sister. He may be the smallest in the litter, but he's certainly not the quietest.
But I can see at the same time that those sutures and just the abnormality that he's suffered with is going to mean that long term he is going to struggle to latch on and consume as much food as his brother and sister. So I would suggest that we do kind of supplement him with a little bottle from time to time.
Definitely. Funny you should say that.
Ah,
I think you should do the honours with this one.
Oh, yes, please. Look at this. Hey, there we go. Oh, you're going to have some? It's a really wonderful, special moment when you get to bottle feed a puppy because they are looking at you like their mum. They're pouring at you with their feet, trying to sort of pressurise the milk as if they were latched on to mum still, and it's a very special moment for me. Well, I think if this feed's anything to go by, he won't be long before he's catching up with his brother and sister.
No.
Hey, little man.
No, no time at all.
Hey. Good girl. That's it. Uncle Michael's house. Yeah. Yeah. Let's see if he's there, shall we?
It's the week of Betty's 12th birthday. But before the celebrations get underway...
Hello.
Hey, how you doing?
How's it going, mate? You all right?
Come on in. Hey, Betty.
She's due for her annual post-op checkup with Scott's friend, specialist surgeon Michael Hamilton.
Sorry, Betty. There we go.
Normally, whenever I see Michael, it's for a social visit, but this time round, I am a client.
I'll tell you what then, Betty. So I'm just going to give you a little stroke/neurological exam.
Betty is an old girl who's suffered a major injury.
Okay, that's pretty good.
So I'm really just coming to see Michael to make sure that she's not painful and just to get a little bit of reassurance.
Pretty strong.
Well done.
Not bad.
Good
Not
girl.
bad. She doesn't look sore to me wandering about. She's not walking normally clearly. She's just a little bit weak and weaker on her left side.
Well, I mean, it's a massive relief for me that she's not in pain. And sometimes as an owner, it's really hard because you have that emotional vested interest to go, oh, are they painful? And you don't want them to be.
Yeah, I know the feeling. Yeah, that's all fine, isn't it? The cause of all her problems is the injury that she sustained 18 months ago, and primarily the kind of an explosive kind of concussion within the spinal cord. There's nothing we can do about that. So I think, relatively speaking, she's doing actually pretty well. All right, Betty.
Eh?
It's good to see you again, though. She's going a bit grey, like me, but she's in great spirits, not painful primarily, and not getting worse. I mean, I think she looks quite good.
She's an older girl then,
Yeah,
but we all
you
have
know,
good days and bad days.
Yeah, absolutely, absolutely. I mean, I think she's managing admirably. You guys are managing admirably. Yeah. But I think for, how old is she again, 11?
She's 12.
12-year-old dog, I think she's kind of doing all right.
Yeah.
To know Betty is not painful and that she is behaving as expected from the surgeon himself is the most important part for me.
There you go. Uncle Michael said you're not painful, and that's good.
What do you reckon, Branston? Are you wondering what type of dog he is? Oh, are you giving him your ball to play with?
In her home in Surrey, practice manager Maz is introducing Buddy the bunny to her dog Branston.
Not sure he's going to go for that game. No. It's pretty cool seeing the two of them interact together. It's so nice to see that Buddy's really chilled and Branston's quite happy with this long-eared puppy that's been brought into the house. Yeah, Brenny, you've got to talk Daddy into keeping him. Just both be cute.
Branston seems to be okay with the new arrival. Now it's time to win over Maz's husband, Chris.
Hello.
No.
Hello.
Oh, hello.
Oh, who's this little guy? I was expecting to see
Well, that's
Dave, but not-
Branston.
Okay.
Hello. So Chris hasn't freaked out that Buddy's here, but I think maybe if he has a cuddle, it might just start to seal the deal a bit. This is Buddy.
Hey, buddy.
There we go.
Hello. I can't believe how chilled out he is. He's just
Isn't he? Isn't he?
laying there, not moving.
He's really chilled out.
And what is he going back tomorrow and finding a home, or?
It's funny you should mention that, actually. Brandy, look at Daddy. Can we keep him? Can we keep him?
Well, is this your idea, Brenny? Well, looks like we've got a new member of the family then.
Yay! It's a great result to know that Buddy's going to now be a part of our family, and it's a great end to a great day. So happiness all round.
Brenny, high five. You want to keep him? Yeah.
Yay! Oh, welcome to the family, Buddy.
Hey, buddy.
Ready?
A week after her eye operation, Spaniel Sega is enjoying runs back in the park, much to the delight of owner David.
Good girl. Can you do a high five? High five. It's great being back in the park with Sega. She is in her element, running around and chasing the squirrels and doing all of those things that she likes to do. That's a stick. Where's the ball?
Vet Phoebe is on her way to check on her little patient's recovery.
Sega, come sit.
Hello.
Hi, how you doing?
Good, how are you?
I'm all right.
It's amazing to see her out here.
Good girl.
Obviously, she's really good in the clinic, but she's just in her element here, isn't
Absolutely.
she? It's really brilliant when you get to see your patients out in the park living their normal lives rather than just seeing them in the clinic where they're a little bit unsure, a little bit uncertain. Sega's just transformed.
You can see she's back to her old self.
Yeah.
Trying to take the stick off me. There you go, have it. Yeah, she's much better. She couldn't wait to get that cone off and just have a run around. Sega, good girl. Come sit. Let Phoebe have a look at your eyes. Come on, good girl.
Let's have
Thank
a
you for the
little
paw.
one. There we go. I think this is the first examination I've done in the park. Oh, they're looking really nice. Sega's definitely on the road to recovery. A lot of the swelling has come down, but the stitches are all holding in place. So when those come out in a couple of weeks' time, they'll just dissolve on their own, then she'll be back to normal.
As soon as she can get back in the water, then that's 100%.
Yeah.
But yeah, she's much, much better.
It won't be long, I promise.
Sega is incredibly important to us. We can't imagine not having her now. Now that we've got her, we're just very relieved. It's not something that's going to just recur. So, yeah, we're very happy with the outcome. She is the happiest dog I've ever seen, I think. She wants to be friends with everyone.
As long as she's got her stick and her ball.
Yeah.
You excited to see Betty for her birthday?
In Richmond, it's time for Betty's special birthday party, and Scott has invited clients, family and staff to join in the celebrations.
Thank you. Betty, look, they're all for you. Look. Look.
everyone. Hello, dog that looks exactly like Betty. Betty, come and look, it's a doppelganger. This party for Betty makes me think back to everything I've been through with her, but also having all the wonderful clients come in with their dogs and reminding myself of all the journeys I've been on with them. So many dogs, a real kaleidoscope of canines. Beer for dogs, you know me so well. Hey, Bobby, how are you, mate? Good to see you.
Okay, best wishes for Betty.
Oh, thank you very much. Oh, good, and still wagging that tail, what she has left of it.
Do you want a party hat? There you go. Happy birthday to Betty.
Oh, thank you. Oh, wow, how cool is that?
Betty is an integral part of our family. She was actually with Scott before we met, so she predates me, and boy does she know it and let me know it sometimes. But she's as much part of the family as any one of us. Happy birthday to you. Happy birthday to you. Happy birthday, dear Betty. Happy birthday to you.
So obviously Betty's a very, very special dog to me, and she went through a fairly significant injury a couple of years ago, and with the help of colleagues and family and friends, she made it through. So it's wonderful to be able to share this special moment with you guys, because I know how much you care about your dogs as I care about mine. When you think that 12 years of your life, that's a huge amount of time, and I've had Betty right beside me the whole time. You know, she's been a constant, steadfast companion. So celebrating 12 years of her life is also celebrating 12 years of my own. So it's pretty special. So thank you so much for sharing your love with my little dog on a special day. So thank you very much.
Yay.